My name's Akshay, and this is Andrew, Greg, and Harry. And together, we're MappD, a unique social networking app that will help connect health professionals to inspiring projects around the world. But first, let me introduce you to my friend, an eager and keen fourth-year medical student by the name of Yohan Kagoma. He's got a problem, though. He's got to book 3 months off this summer for a volunteer clinical elective. But this experience is going to help him pick a career, expand his clinical skills, and make some awesome memories at the same time. However, he's got a big problem. He doesn't meet the credentials for organizations like Médecins Sans Frontières. And when he takes a look at the forms a little bit closer, there's no way he's going to be able to commit to the 9 months minimum requirement. And he can't afford the few $1,000s it takes to work with a medical tourism company like globaltourism.org. There are nurses, OT, and physiotherapists with the exact same problem. That's where MappD comes in. We're a unique delivery system that helps connect health professionals to inspiring projects, let them discover new ones, and publish their own ideas. So let's take a look at one way MappD can help Yohan discover his potential. So he's in medicine, but he can easily be a physiotherapist or an occupational therapist. And he likes pediatrics, but he's not fixed on it. And right now, he is willing to go anywhere in the world. And July is looking pretty free for him. So he plugs in his search criteria and starts to map it. We take a look right now, and we've got some pretty cool hits based off region. There seems to be a cleft project, the cleft palate project in Nepal. There's a pediatrics in Africa, but he's never been to India, and I think that would be really interesting. So let's take a look. So there's a few more specifics now on this slide. We get to see a women's health project and a acute trauma care project. But wait, something catches his eye at the bottom. A pediatric cardiac surgery hospital in Bangalore, India. That's one we're going to want to look into. So he's got a little bit more information about who they're looking for and when they have dates available. This is starting to work for Yohan. Going through, he sees some interesting things here. But wait, they're not just a typical cardiac hospital. They connect rural clinics via telemedicine through the Indian Space Agency. That is really cool, and Yohan is hooked. He immediately starts messaging through MappD, the program director. He starts reading reviews from past participants, and he even follows the app, so he's always got it in his back pocket. So let's go from here. But his project doesn't end here, and neither does his journey with MappD. He has a unique way to connect with individuals, to publish his story, so that his family, through Twitter and Facebook integration, can follow, and the whole MappD community can follow along with it, even pledging support, which is monetary. MappD is an easy, inexpensive, and mutually beneficial project that we're really excited about.
How do you attract users to the app?
It's a great question. And we have some great people here that also work in social networking. We suspect that we're going to go in a way similar to Facebook. We'll be exclusive to medical students, to nursing students, getting validation straight from their Alberta Health Services or western.uw.ca website. That'll give us a very specific user base where we can kind of curate our own content. And that's how we'll start. Eventually, when we reach tipping point, we want this to be self-sustaining, where individuals and users in different clinics can publish and support their projects.
And how is this going to be monetized? Who are going to be the people that are going to pay, and how are you going to be able to develop this further?
So we come from kind of a social enterprise standpoint, so this is going to be a not-for-profit. But all the revenue and money we do make goes back into helping individuals and the projects connect. We suspect we have 3 ways and 3 potential models of revenue. One, which we kind of touched upon earlier, is when Yohan follows his project. Let's say he doesn't have the time commitment, even though he thinks it's great, but he really believes in the project. He can pledge money, and through that, MappD can take a 2 to 3% cut, potentially, of that. Secondly, I think we need to work with strategic partnerships, starting from Calgary here. I think there's going to be lots of companies, banks, institutions, Alberta Health Services that want to support a project that's not only charitable, but creates better experiences for their users and employees. And I think it's a really good idea. Thirdly, and if we need to, I think there is some definite potential for once someone commits to a project, we can have some unique advertising, whether it's travel insurance, airplane tickets, and things like that. That hasn't been fleshed out yet, but that's why we're here, I guess.
15 seconds left.
I think it's exciting. This is international potential. One of the challenges we have is rural and remote rural here in the province. How do you see this being applied internally in Alberta?
Yeah, I think it's going to be fantastic, especially with previous projects like telemedicine being mentioned here. There's a need in Canada, and I've done a lot of rural work, and I think what's important here, and it's nice it works with MappD and the team, because you not only the important thing is that you not only make a difference, you make a difference where it matters the most. And I think there will be lots of clinics that will want to support this kind of service.
Awesome. Give it up for Matt.